Hi, everyone. I'm Heather Carter,
Hi, I'm Dr. Shad.
and we are coming to you via a recording with weekly conversations. And we want to talk about issues related to individual health and community health. We are both extremely passionate about this, and we hope that you are as well. And we're looking forward to talking with you. And before we begin, I want to just sort of share my personal health journey with you and why this is really important to me. So I just turned 50 last year, so I'm 51. And of course, when you reach that midpoint of your life, you start to take an inventory of what are you doing to set yourself up for the next 50 years. And I looked in the mirror and I didn't necessarily like what I saw. And I looked at my parents and I um, was concerned about their health conditions. My dad has passed away and my mom is elderly, and they suffer from many chronic conditions. You know, when you go into the doctor's office and the doctor asks you, has anybody in your immediate family ever had, and then there's a long list of health conditions. I don't even bother to go through and mark and read each one. I just mark yes to all of them. Heart disease, congestive heart failure. My dad had rheumatoid arthritis. The cancer is run in our family. And I didn't want to have that same sort of health outcomes, especially in the second half of my life. I wanted to make a healthy choice so that I could hopefully prolong, my time here on earth. And in doing so, I needed to make some big changes. So approximately 2.5 years ago, I embarked on a plant-based whole food journey, and it has tremendously changed my life. My family is on this journey with me. So my husband, my daughter, we've all adopted a new healthy lifestyle around adopting a plant-based living. And so in my professional life, I had the opportunity to meet Dr. Shad. I'm going to kick it over to him and let him explain his personal journey, and then we'll take it from there.
Thanks so much, Heather. I appreciate it. This is a real great opportunity. I think for me personally, one of the reasons why I went into medicine is because I feel a passion to be able to help others and specifically to help empower them to achieve optimal health in all aspects of life. And I feel the challenges with our healthcare system, and one of the things that I noticed early on in studying the history of medicine as a student was that we have tended to focus a lot on acute disease treatment and very little on prevention, very little on primary prevention. When we look at the diseases of our time, the majority of these diseases are longer term chronic diseases. And there's so many different lifestyle risk factors that go into these over the course of a lifetime. You can't catch a heart attack like you catch a cold. It's something that takes decades, right? It's the end result of a process called atherosclerosis, where you have narrowing of your arteries, and that ultimately leads to that heart attack or stroke. And so opportunities to educate and learn how we can prevent those events that are life-threatening, that can be very tragic, like you mentioned, some of those conditions running in your family, Heather, and many people, right? So I think being able to share that with the public. And I think for me professionally, as a physician, also as a medical educator, I serve as an associate professor of family, community, and preventive medicine here at the University of Arizona College of Medicine, Phoenix. I also serve as the director of our public health prevention and health promotion curriculum, which oversees our culinary medicine, nutrition, and integrated medicine curriculum. I really feel there is a need to disseminate the evidence and what we're learning about the role of lifestyle, including diet and exercise, as well as a positive mindset, into the community. We're also seeing some of the work that I'm involved in more underserved settings, where there's rampant diabetes, for example, and food insecurity. The students that I work with, we have started group visits with cooking classes with chefs, and we're looking at how actually learning how to buy and prepare healthy foods and give food prescriptions and use this mechanism as a means of education can really empower patients and make a big impact on their health. And I do that as well in my own private practice with my patients. So I'm really excited to be able to share this. with the world, and to work with such an amazing professional as Heather, who really spans the range from policy and public health, population health, to education. And so, love to hear more about your background, Heather. I think it'd be important for folks to hear.
Well, thank you for that. And that's sort of where our paths collided. So I work at the University of Arizona in the Melanita Zuckerman College of Public Health, and I'm also the Associate Director for the Arizona Center for Rural Health. And in that role, work with a number of community organizations, connecting them to our students and providing real life opportunity for our students to engage with different health projects across the state. And then as well, in the legislative setting, I served for 6 years as the House of Representatives chairwoman of the Health Committee, and now serve as the Senate vice chair of the Health and Human Services Committee. And I serve as the chairwoman of the Higher Education and Workforce Development Committee. So it's kind of like all of these worlds collide around health and education. And I've been at the university setting for almost 20 years now. So almost 2.5 years at the University of Arizona, and in 17 to 18 years at Arizona State University. And technically my doctorate degree is from NAU. So we are Switzerland when it comes to our state universities on this conversation. But I will tell you, my background prior to getting elected and then serving in a role that provided me the opportunity for leadership in the healthcare industry, I was a middle school teacher. And so I sort of see the life continuum of my students who would come to school, and obviously we wanted to make sure they had a healthy breakfast and a healthy lunch. And when they went home at night, to make sure that they had some sort of food in the evenings, because I worked in an area that had a large number of students who were identified as free and reduced lunch recipients. And so this whole concept of building a healthy childhood, which then will lead you into adulthood, so that you're not worried about your health as you're trying to live your life and raise your family, has just come sort of full circle for me as a professional. So that's why these weekly conversations will really focus on both the individual opportunities to make a healthy choice, and what we can do as a community and from a policy standpoint to make the healthy choice the easy choice to make. And that's where we're going to have these worlds really, really come together. So I'm very excited about that. And that's what we're going to do. So why are we doing this, and what are we doing? So every week we are going to come together, Dr. Shad and myself, and address questions that you send us. We want to make this information easily accessible. And I know that if you're like myself and Dr. Shad, you're on social media, you watch the evening news perhaps, you receive an email from loved ones, and it's really hard to kind of navigate through just this information overload. And what's real? What's based on science? How do you navigate that? That's what these conversations are designed to do. Help you navigate the information that's available for you to make an individual healthy choice, and for you to help make your community set up so that others can make a healthy choice as well. I'm a teacher by trade, and I feel called to just share the information that I've gathered as an educator with not only my students, but with the community and the state at large. And then, these are on social media, so they can go national and international as well. And Dr. Shad, when we first talked about this, you really brought up why it's important to have these quick 30-minute conversations.
Yeah, one of the reasons, as you mentioned, Heather, which is so important to have these conversations, is because of the information overload that people experience, and because of the fake news and the false kind of things that are circulating out there, where people don't actually know what's based on science, what's based on data, what's real and what's fake. And so I think trying to decipher that with community issues and policy issues, health topics that really matter and can make an impact for individuals and families, that's what we really want to get at. And another thing that you point out, another reason for this, is because unfortunately, not only is the information misleading and confusing, but the way that things are set up at times are not necessarily conducive for us to act in the most healthy way
Right.
possible, in terms of how unhealthy foods seem to be so cheap and widely available. What are the things behind that? How can we overcome that? What are the things you need to know as a consumer? How do you make those choices when you go to the grocery store? Or in this day and age, I think another reason why we wanted to start this via Zoom is because a lot of us are at home, and a lot of us are dealing with this global pandemic, which is really exposing the need to take care of ourselves and take care of our health in new ways. And so, along those lines, our initial session next week will be looking at some of the data that's emerging, and in connecting chronic disease and chronic disease risk factors with increased susceptibility for poor outcomes with COVID-19 coronavirus infection. And so we're going to talk more about what that means for you, what the data is showing, and how to protect yourself and your family.
Boy, I think that is a timely conversation, and we'll be pushing out this video as a means of gathering interest for that next conversation that will happen on Friday of this week. And, we get asked questions from our loved ones about this very thing. I mean, the news is there's just an onslaught of information of if you have diabetes or if you have high blood pressure. So next week, we're going to divide up the conversation sort of into two parts. Dr. Shad will really dive into the individual information that we have available with the up-to-date, most recent research around COVID-19 and the chronic condition. And I'll share just top-level highlights from the most recent National Health Survey. And it's shocking. So when we put this video out for people to continue to participate in these weekly conversations, and we make this next call, be about, hey, if you have high blood pressure or you have diabetes or any other chronic condition, tune in on Friday to get some of your answers, get some of your questions answered. Boy, talk about a wide audience. That's,
Oh, yeah.
When I share the top line survey research around the National Health Survey, I think people will be shocked. So we'll kind of bring this conversation to a close here. Any final comments for the conversation, Dr. Shad?
No, I think it's exciting to be able to talk with everyone. I really encourage anyone who sees this video to send us messages via our social media. Any questions you have, any topics that you want us to discuss or focus on, because we really want to make this about you and what your needs are.
Right. So I will be sharing this to a variety of social media platforms. I'll share it on my personal Facebook. I'll share it on 2 new Instagram channels that I have created. Dr. Shad will share it on his channels as well. We're just trying to reach a broad audience. And for these conversations to be really meaningful, we need to hear from you. So send us your questions. We have about 3 days to gather them. We'll review them prior to starting the next recording, and we'll post that next recording on Friday afternoon, and we'll include some of your questions. If you'd like your name listed, you can even just give us a first name and we can answer your question directly, or you can just ask a question anonymously. But there's a lot of information that's coming out quickly related specifically to COVID-19 and chronic conditions. So this will be an episode to tune in for sure. And then, like we said, every week we're going to be back at it, and we're looking forward to starting this journey with you, because we want to make ourselves available to you, not only as educators, but as a healthcare professional, so that we can just cut through the noise and give you information direct and in a very concise, quick format that you can access and share with your friends and family. So thank you for listening today. And Dr. Shad, thank you for tuning in.
Thank
and
you.
We'll see you again on Friday.
All right. See you all soon.
Bye-bye.
Bye.